Hi, I'm Sarah Greenberger, the UAMS Emergency Medicine Residency Program Director. We appreciate your interest in our residency program. We usually begin our interview day by sharing what we think makes UAMS special. So I wanted to spend the next few minutes talking about where we've been, who we are now, and where we're going. The UAMS Department of Emergency Medicine was founded in 1983, and our residency program started the following year, so we already have a long-established presence in the hospital. Initially, our program focused on training resident physicians who would provide high-quality clinical care to the citizens of Arkansas. But we've since grown into a department that has broadened our focus, recruited faculty from across the United States, and now encompasses a division of research, a division of ultrasound, and a division of education. Our department chair, Dr. Tony Sapal, is also the hospital's chief clinical officer. And another one of our faculty, Dr. Sophie Morgan, is the associate chief quality officer for patient experience. So our department and our people are integral parts of UAMS. At the core of our residency, however, is our philosophy of shared ownership. You may have seen this mentioned on our website or in our FAQs, but because it's such a key part of who we are, I wanted to describe it in a bit more detail. Shared ownership essentially means that our residents have a voice in who we are and what we do as a program. All residents are members of our education committee, EdCom, which meets once a month and has 5 resident-run subcommittees. At EdCom, we discuss how things are going, what we'd like to improve, or which new initiatives we'd like to tackle next. Residents develop proposals, discuss them at EdCom, and then work to make changes that drive our residency forward and lead to continued innovation. We believe that our residents' perspective is valuable and their voices should be heard. So we also support resident participation in hospital committees, our local ACEP chapter, our community, and national organizations. I mentioned innovation earlier, and that's important to us as well. While we believe that UAMS already offers an excellent training experience, we're committed to continually reevaluating our residency program and developing new and better ways of doing things. For example, we recently overhauled our conference curriculum to move away from traditional lectures in favor of a new format, our Chimera curriculum, that blends 20-minute mini lectures and small group case-based discussions to promote active learning. We also believe strongly in the importance of diversity, equity, and inclusion. So this year we've incorporated implicit bias training and discussions about systemic racism into our curriculum. We strive to train a diverse and culturally aware physician workforce, but we know we still have much work to do to improve the diversity of our program and to address healthcare disparities and social justice in our community. Another example of how we're working to enhance our program is our PGY3 elective collection. We're currently working on developing a slew of new and innovative elective options, from healthcare management and leadership, to digital health and clinical informatics, to an acute pain management elective that provides training in regional anesthesia techniques and ultrasound-guided nerve blocks. We have so many ideas and want to keep the forward momentum going. Applicants often ask us if we foresee any changes in the program during the 3 years of their residency. I can tell you with near certainty that there will be changes in the future because we're just not satisfied with good enough. We're always striving to be better. Our applicants often ask us what we're looking for. We're looking for residents who are teachable and committed to their own education. Our primary goal is to help you become an outstanding emergency physician. But we're also looking for residents who believe in our philosophy of shared ownership and who will help us carry out our mission and vision by being actively involved in our program now and in their own communities in the future. In return, we will provide you with an evidence-based education in a supportive environment, and we promise continuous improvement and innovation as we strive to deliver the best residency training we can offer. There's so much more I could talk about, but I'd need at least a few hours to list all the reasons we believe UAMS is a special place. Thank you for your interest in our program, and we're looking forward to meeting you soon.